gas station heroin. What am I talking about? What names does it go by? Tianna Red, Tianna White, Tianna Green, Za Red, Red Za, Devil's Kratom, Tia Max, Za Silver. It's actually a legal drug in France and some Latin American countries and some Asian countries. It goes by the name, its chemical name is Tianeptine. It goes by coaxyl, stablon, and tetinol. Tianeptine is the active ingredient. It comes in two salts, tianeptine sodium and tianeptine sulfate. The sulfate is the longer acting version. I think that's all the formulations you find in gas stations, and all the formulations in the US is at nootropics.com, or in gas stations is the tianeptine sulfate. The reason is it lasts longer. What is the reason this drug is being sold at these gas stations? Well, let me give you a little history, what its legal purpose is first. Its legal purpose is as an antidepressant, an anti-anxiety, asthma, irritable bowel. I've seen reports that it may work for attention deficit disorder and post-traumatic stress disorder. It seems to be a reasonable compound. When given in doses 12.5 milligrams twice or 3 times a day, maybe 25 milligrams twice a day, somewhere maxing out around 50 milligrams a day. It works as a reasonable antidepressant. Its mechanism of action, here we see why it's a problem. It's a serotonin reuptake enhancer. So it doesn't block the serotonin pump like the common drugs in the US, Prozac, Paxil, Zoloft, Luvox, Celexa, blah, 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 blah. It, like, remember Spravato, esketamine, Riluzole, that I use for treatment of depression, it blocks a glutamate receptor, the N-methyl-D-aspartate receptor, which can help depression. You block a little of glutamate, you can help depression, like esketamine, Spravato, Riluzole. You block it too much, you can't remember, you can't learn, and your cognition is completely shut down. A little is good, too much is no good. It also stimulates as a full agonist. That means it's a full throttle activator of the mu opiate receptor. What does that do? That does exactly what oxycodone does, heroin, fentanyl, oxycodone, blues, Percocet, all that stuff, those opiates, it does that. And that becomes extreme at higher doses, and this is why it's abused. So, normal doses, 12.5 twice a day, 3 times a day. Maybe the max you get on this drug is 50. When you buy Tianna Red or Tianna White or Za Red, they're 25 milligram pills. And what do my patients do? Someone just came in and told me that he was messing with this stuff. And I'm like, I remember this from like 10 years ago. And he's like, oh yeah, people are messing with it again. I was like, how's it even on the market? But I think you can buy it at nootropics.com, and it's in these gas stations. And of course, my patient takes 8 pills, 4 pills. So he's taking 100 to sometimes 300 milligrams. And what does that do? That gets you high as a kite. You get that itchy feeling. You get that flushing feeling, the euphoria, because it's an opiate agonist. It means it stimulates the mu opiate receptor. Doesn't do much for the kappa and delta, but it hits that mu, which gets you high. That sounds really good. And there's a but here. I mean, the side effects of this drug are headache, dizziness, constipation, insomnia, extreme nightmares. Higher doses, it can cause drowsiness and that euphoric feeling. Here are the problems. It's got a really short half-life, like 2.5 hours. Full metabolism of a drug takes 5 to 6 half-lives. So you figure in 12 hours, you're in withdrawal from this drug. It's even quicker than heroin. So what does that mean? So you take a lot of it, and you're abusing it. You shouldn't really exceed 50 milligrams a day. And I'm getting people, they start at 50 to 100 first dose. This patient went through a bottle of 60 25s in a day. Man, when he was done with that bottle, that poor soul, he was miserable. He went into a withdrawal headache. horrible headaches, muscle aches, diarrhea, nausea, sweating, foaming at his mouth, like drooling in his bed, aching and belly aching. I helped him out. I dealt with it. But you need to be really careful with this stuff because it's short half-life, and at high doses, it hits that mu opiate receptor, and at high doses, it's cardiovascular effects and kidney effects. So it knocks out your kidneys, and it has heart abnormalities at higher doses and hepatotoxicity, meaning it affects your liver. So yeah, gas station heroin is no good. But people try it. I would be real careful with this withdrawal that will ensue. So you'll go through your bottle in a day like everyone else, because as soon as you take it, it wears off in 3-4 hours, and then you're miserable. So you take more, and you keep taking, tolerance develops right away on this drug. So first someone starts with 2 or 4 25s, then they're 4 to 8, then they're 8 to 10 25s at once, and the next thing they know, they've gone through a bottle of 60 in a day. So you go through this stuff really quickly. I'm not a fan. Maybe it works as a good antidepressant. It's a novel atypical antidepressant. But you remember, you're blocking too much of that glutamate. Your cognition will get impaired at higher doses. At low doses, it seems to help with cognition. It helps with attention deficit disorder, helps you think. The good news is it's really hard to overdose. It doesn't seem to have the equivalent of respiratory depression like heroin and opiates. So all in all, this gas station heroin, I would tend to avoid it. But just so you know what you're dealing with, you're facing, you'll get a high and you'll be made miserable probably within 15 hours to 20 hours after taking it. You'll be absolutely miserable. You probably won't die though. It's pretty safe an overdose. So thanks for watching. I appreciate likes, subscribe. My book's on Amazon.com, Tales from the Couch. Any comments? Anyone out there try gas station heroin? Let me know.